So thanks everybody, and thanks for the opportunity to present today. So as Kate said, I am the Principal Public Health Practitioner in the Betsy Cadwallader Local Public Health Team, and I'm now going to present on establishing planning and health relationships. I'm part of the Healthy Weight, Healthy Wales whole system approach team, and there is a Wales-wide team across Wales. So here in North Wales, planning has been identified as one of our initial priority areas for our whole system work. But prior to my role here at Public Health Wales, I worked in the public health team for Cheshire West and Chester Council, just across the border in England, where public health now sits within local authorities. And I've been asked today to speak to you regarding the work I did with the planning team, specifically with development management over in Cheshire West and Chester. So this presentation will focus on joint working opportunities between public health and development management. We'll outline the development of a health impact statement in Cheshire West, and we'll showcase 2 case studies that illustrate this joint working. So there are a number of opportunities for public health and development management to work together during the planning process. So at pre-application stage, so we can offer advice around the need for development, offer data on the local area, highlight any initial health concerns, and confirm if a health section 106 would be requested. At full application stage, we can respond from a public health perspective to that application, confirm whether a further in-depth HIA would be required, and again, request for health 106. We can also offer ongoing support and advice, and all are a two-way process with both public health and development management supporting, advising, and learning from each other. So within Cheshire West, public health and development management work together to produce and implement something called a health impact statement. And the development of the health impact statement was outlined in our local plan part 2 for Cheshire West, and it sets out what is expected from an applicant. It's a way of ensuring that health is considered in the application, and for public health then reviewing the application, it ensures all of the health information is in one place. The health impact statement is completed at validation stage and submitted alongside the other supporting documents for the application. In Cheshire West and Chester, a health impact statement must be completed for all major planning development proposals. So in Cheshire West and Chester, that's defined as 10 dwellings or more, or 1,000 square metres, and that will be reviewed. But initially, a health impact statement was for all of those major planning applications. The areas covered within the health impact statement in Cheshire West and Chester were around transport and public service accessibility, green infrastructure, health and wellbeing, and open space, sport and recreation, and also housing. And the reason that these areas are covered are those are the ones within the local plan part 2. So if we want to encompass other areas within the health impact statement, they'll need to be added into the local plan when it's at its review stage. So the health impact statement includes a template table, and you can see that there on the slide, that should be submitted as part of any information provided in support of the major planning application. I've popped a link there on that slide, so you can have a look at the health impact statement on the council website. And if you wanted to look on the planning portal, you'd be able to see if impact statement as part of their application. So the health impact statement is essentially a desktop HIA, and therefore in certain circumstances further information or assessment may be required, especially where significant impacts are likely. But what we were finding within Cheshire West was that every major planning application would fill in a health impact statement, but there would only be a handful that then would need to go on to fill in a full HIA. So it was a way of us ensuring that health was considered within each application, and as I said, really gave a simple way to public health then to be able to respond to that planning application, because all of the information we would require would be within the health impact statement. So I just wanted to give a couple of examples of how this joint working between public health and development management was seen in fruition really within Cheshire West and Chester. So this first case study illustrates joint working for a residential development. So this was a 13-hectare site for 395 dwellings. The health impact statement was submitted to support the application, and a health section 106 contribution was requested by the CCG, so the NHS over in Cheshire West. So the health impact statement outlined all of the health information, as I said, in one place. And in this application, it highlighted the cycling and walking opportunities linked to the site, but also highlighted where some requirements were missing from this application, such as EV charging infrastructure in this application. And we were able to therefore address that. Completion of the health impact statement also signposts to other submitted documents that may have further information which would be beneficial for public health to review, such as a sustainable construction statement. As I said, the NHS did request a 106 for this contribution for this development, and they reviewed GP surgeries within the catchment of the site and gave a detailed description of the capacity and existing infrastructure. The requested contributions are broken down by dwelling type, so 1, 2, 3, 4 bed, and response sets out how the 106 request is necessary, directly related to the development, and reasonable. The second case study that I wanted to showcase is for a change of use application from an A1 retail to an A5 hot food takeaway. So for this particular application, public health raised concerns relating to health challenges within that area, so specifically around obesity, deprivation and self-reported health for the area. Also the proximity to educational settings. So this particular application was within less than 1 mile from a youth centre, a secondary school and 2 primary schools. And the third concern that we raised was around the proximity to existing hot food takeaways within that small area, and therefore the proliferation of hot food takeaways in a small town centre area. So for this particular application, it was refused on health grounds. The case officer felt that the proposed development, so we used the concerns raised by public health. So the proposed development was in close proximity to a number of schools and near to a number of other fast food takeaways, and in an area which has been shown to already have significant health challenges, which would be compounded by this development. They felt that no information was provided that demonstrated how health and well-being had been taken into account. And as such, cumulatively, the development will give rise to a significant adverse effects on health and well-being. Really importantly, this was in conflict with the provisions of the local plan and the local neighbourhood plan. So specifically refused on those grounds. I haven't been asked to cover Cheryl's slides, but I know that they will be available on the website after today's session. So I'd just like to thank you all for your time, and I hope this presentation gave you a flavour of the work that public health and development management can do when working together. Thank you.